Hi, Sandra Wilson here, clinical hypnotherapist who helps people with skin picking and hair pulling. So today's question is, how can I explain my trichotillomania, hair pulling, to my family who are not very supportive or sympathetic and they think that I just choose to do it? So explaining trick to an unsupportive or skeptical family member can be challenging, but a clear and factual approach is often better in helping them to understand it. So here are a couple of strategies. Number one, keep it simple. So explain that trick is a recognised mental health condition. It's not a habit or a choice. It's actually classified as obsessive compulsive disorder, even though there's a little bit of debate about whether people have both conditions and whether it's the same condition. And it involves an irresistible compulsion to pull hair out, which can release tension in the mind and body. It can be very good at relieving stress, and we often do this without realizing we're doing it, and that is unconscious. It's an unconscious habit. So you could try using comparisons that your family members could relate to. So if they struggle to grasp the condition, you could compare it to something they may understand, like nail biting or skin picking, but with hair. And it's kind of similar to an addiction in many ways. The urge builds up inside you, and the pulling brings relief. And even if you don't want to do it, the urge is incredibly powerful, and it is unconscious or subconscious. So you could try to address misconceptions. If they just dismiss it as a bad habit, you could, and they say things like something you could stop if you really, really wanted to. Very, very common. Gently correct them and just say something like, if it were that easy, I would have stopped already. And willpower alone doesn't cure conditions like anxiety or depression or OCD. Would you tell someone to use willpower to just snap out of a depressive episode? Of course you wouldn't. And just gently explain that shaming you or criticizing you only makes it worse, because it's building up anxiety, which actually is one of the key emotional drivers that drives trick in the first place. So, and the emotional side, it's not just about hair, it's about managing overwhelming feelings. Stress and anxiety, as I said, being the big ones, although boredom, overstimulation and other things, losing a sense that you don't have any power or control in your life, can be very common. You can explain that you often don't realise you're doing it till after you've done it, and that when they tell you to just stop, it makes you feel even more guilty and ashamed, which again makes the urge even stronger. So how can they help you? You could try to appeal to their logic that yes, therapy may be helpful for you, because a therapist will not judge or run out of patience or try to tell you to do things that just aren't helpful. A therapist will not criticize you. But if your family are not being patient with you and they are criticizing you, it's just going to make the pulling worse. Okay, so you can maybe direct them to helpful websites. There is a couple of websites predominantly around the pulling. I think it's called Habit Aware. There are numerous trick-related websites you could direct them to. In Britain, it's the NHS, Mind, or the BFRB.org, which is Body Focused Repetitive Behaviours. And these might be good resources to help your family learn a little bit more about the condition, rather than just chastising you, criticising you, shaming you, telling you to just stop. And I hope that's been helpful. Bye for now.